program, please stop by then. With that, I'm going to turn over the microphone to my friend and colleague, Adele Oliva. Adele is the founding partner of 1315 Capital, which is a healthcare-focused fund also based in Philadelphia. With that, Adele, take it away.
Hey, Ryan, great to see you again. And thank you for the introduction. As Ryan said, I'm with 1315 Capital. We're a healthcare growth equity firm out of Philadelphia, focused on expansion and growth equity with $500 million under management. I want to thank Ryan for helping to put this great panel together, and am very excited about the panel that we have today, given the pivotal time it is in healthcare. This is a group that lives healthcare every single day, and they're going to bring in-depth perspective to 3 topics. First, we're going to talk about the challenges presented by COVID-19 and the responses healthcare companies have made. Second, we'll dive into care delivery and business model changes created by COVID. And then finally, and Michael, we're going to call on you heavily for this section, we're going to be talking about the M&A environment. We have a ton to cover. I'm not going to be given the typical deep dive intro, so I really encourage you to look at the bios that come along with this program. And I'm going to start with the first theme, which is operational challenges. And let's see, we have Greg, Michael, Sunny, and waiting for Chris to join. Well, hey, Chris. Great.
Hey,
so thank you. Thank you all for joining us. Sunny, we're going to hit operational challenges first out of the gate. And I can't imagine a better perspective than a PICU registered nurse. You started at Phoenix Children's Hospital. You've quickly moved up to the C-suite. You look very young on camera. So as COO of Bristol Hospice in January 2019, you just have to be ingrained in terms of the delivery of care and dealing with the most challenging settings. Bristol operates 36 locations across 10 states. You provide critical hospice and palliative care services across the continuum. Talk to us about how your group is managing the health and safety of your patient population during this pandemic, and any key things that would be helpful for the audience to understand.
Yeah, thanks, Adele. Appreciate it. I think our number one mission, as we all unfortunately stumbled into this new world, was making sure that our patients and the teams providing their care did so safely as they could, given the current environment. We really looked at it. There were a lot of concurrent things happening at the same time, but the biggest takeaways from an operational perspective to mitigate that risk was looking at it almost like a disaster. And so we created an incident command center, a multidisciplinary task force to, at the time we had CDC guidances and state guidelines coming at us rapid fire. And so we really wanted to make sure that we got all the information in so that we could respond appropriately. And so we had a number of folks really manning this incident command post. And then communication is absolutely key. Unfortunately, you hear stories in the industry of when there wasn't the communication, when there was those failures. And so that's one thing we over-communicated, and we felt okay doing that because there's such emotionality around all that was going on. There was a lot of fear and there was a lot of concern about it. And so we wanted to over-communicate everything that we were doing to ensure that we were keeping our patient population and our team members safe. And so we had updated emails on a very regular cadence. We had leadership calls on a daily basis. And then securing PPE. I think everyone across the industry had such a challenge securing the amount that they needed to ensure that we kept our teams and our patients safe. And so we were fortunate in that we have the leverage, and we are a large company, that we were able to secure large lots of PPE. You know, not everyone was as fortunate as that, and there were a lot of challenges when it came about. We established par levels to make sure that every location had at least 2 weeks worth of PPE to be able to care for any COVID patients that were coming in play. And having all that PPE, you have to keep a really close eye on it. So we kept a live document where we tracked every single item of PPE across the country to ensure we had a global understanding as to where it was needed, and how much we were going through. And so we just updated that daily and kept a really close eye on how that was spread about. And then the daily screenings and COVID testing was something that, you know, we had never done before. And so that was really rapid fire into making sure that anybody who came into an office had their temperature checked and symptoms checked. And we have a large footprint in the long-term care space. And so we see the news, we hear the reports. There were large incidences of outbreaks inside of those buildings. And so we wanted to make sure that we were testing at an appropriate cadence for each of those facilities in each state to make sure we were keeping everyone safe.
That's terrific. That is a tremendous amount of logistics you've had to manage.
Yes.
I can't imagine how many hours a day you were working in March, April, May, June, and still right now it had to be pretty taxing. Greg, you've also had a very rapid rise in your career. You co-founded HEAL in 2014 to provide a more convenient option for primary care. And within 6 years have really achieved a tremendous amount of recognition as well as success, including designation of number 13, I believe, on the CNBC Disruptor 50 list, and most recently receiving a $100 million investment from Humana. Your perspective on bringing care to the home is really incredible at this time. And we would love to hear some of your views around how business models are changing in terms of the delivery of primary care.
Thank you, Adele, and it's an honor to be on this panel with such a great group of people, and this is a great event and a very new format than I think we're used to conferences in the past. So well done to the organizers and sponsors for putting together such a great platform. So hi everybody. As Adele mentioned, my name is Greg Drobnik. I'm one of the founders of HEAL. And ironically, we do one of the most old-fashioned things maybe in the history of medicine, being the doctor house call. But we've modernized that a ton with a great web app and mobile experience. Prior to coronavirus, the majority of the patient interactions that we would have, which are based around primary, preventative, and urgent care, would take place in the home environment. And for us, while we had a great set of tools and features that would allow doctors to do follow-up visits with their patients via telemedicine or video chat, the majority of our visits and patient interactions were in person in the home. In light of coronavirus and in an effort to limit the person-to-person contact, we basically reversed that proportion. So the large majority of our visits started as telemedicine-based or video-based, and then we would use the in-person house call on a much smaller basis for those most needy patients, and after we followed a certain set of protocols to make sure that the environment was safe both for the patient and for the doctor. Similar to what Sunny mentioned, we obviously would use PPE when we were seeing people in person to provide the most level of protection for the providers and the patients. And we've found that everyone's gotten pretty comfortable with that as the different cities have been able to flatten the curve, and we've been able to go back to seeing more and more people in person. Fundamentally, what we do is trying to practice an unrushed version of medicine We've all had those scenarios, whether at an urgent care center or an emergency room or seeing your PCP, where there's a waiting room full of people, which for better or worse means there's lots of germs there, right? They're there because they need help, but it creates a contaminated environment for others that are in that space. We wanted to create a comfortable environment for families that would allow them to maximize their time with the doctor, allowing the doctor to also see social determinants of health and somebody's environmental factors, which can be very important in navigating a care plan. And so by the nature of what we do, given we don't have any brick and mortar aside from some of our corporate office space, all of our providers are out in the field. And so also the fact that those working in our corporate environment, that element is really more of the vertical of a technology company than anything else. And so the elements of working at home or working remotely or working in a mobile environment is actually something that we had been doing sort of as part of our DNA from the early stages of our company. So when the coronavirus hit, while we made adjustments to our care delivery model for patients, we didn't have too much disruption to our corporation and our day-to-day runnings because we're used to being a very mobile-centric company to begin with. But fundamentally, what we're able to do is offer patients a safe environment in light of coronavirus to get care for their family in their home. We are offering the same benefit to the doctors to spend that unrushed quality time with patients. And then ultimately, because the providers are very engaged in delivering the best medicine possible, and the outcomes are very favorable with the patients, that of course makes the insurance companies very happy because we're able to engage members in a meaningful way, which ultimately helps with lifetime value of those customers, retention for very happy members, and ultimately the cost of care goes down, right? Which is a cost savings to the insurance companies. So I think it's those factors touch on a couple of the areas that we've been thinking about pre and during COVID, and also part of the reason that we were in fact honored to be on that disruptor list from CNBC and welcome our new partner Humana to the company as well.
So, Greg, how many or which aspects do you think will persist, right? Because your business model shifted a bit with moving towards more telemedicine. Do you expect that to remain as COVID starts to become less of an issue?
So fundamentally, I think the short answer is yes. Our care model has always been, we think, a multi-pronged approach. So while we do think it's important to have a doctor in person on occasion, we also think it's important that they don't always have to be there, right? There are certain things that telemedicine can be a great tool for. There are certain things that remote monitoring can be a great tool for. And so our providers really think of this as different ways of interacting with the patient that ultimately create efficiency within the system and for that family. What I do think is a new dynamic, which is going to be a big shift, I think, for a lot of folks that play in this ecosystem, is I think there's a big segment of the population that would not think to get care this way before coronavirus, right? They might be in a more regular pattern of going to brick and mortar facilities. They might have been hesitant for any number of reasons to interact with doctors, either in their home environment or over the phone. And so I think our care model will evolve, but that is pretty similar to our thinking pre-COVID and during COVID. But I do think it unlocks an entirely new population of people who will start interacting with the healthcare system in this way.
Mm-hmm. Yeah, I completely agree. And Chris, you bring the other perspective, right? You're at Mass General Brigham, one of the nation's largest academic research enterprises. Chris is just one of the most amazing individuals. He was at the Cleveland Clinic where he wrote a book on healthcare innovation. He now leads a team of over 125 professionals focused on commercial applications of the unique capabilities of his hospital system and the 74,000 employees within it. He also leads business development, has a tremendous amount of commercial responsibilities, and while doing all that, manages a $200 million venture fund. I have to say, as someone who manages a venture fund, I feel very narrow compared to what you're able to accomplish on a day-to-day basis. So why don't please help us give us a view into how operations evolved during COVID and which ones of these changes do you believe will persist and maybe are for the better?
Well, thanks, Adele, and thanks to you and ACG, both Boston and Philadelphia, for having me speak. I would say my perspective probably picks up from both Sunny and Greg. I think at the highest level, the problems that confronted caregivers and the solutions that were deployed were known prior to COVID. So if you talk about the digital solutions, we were already in the process of reinvention prior. We had made a $500 million commitment last year to upgrade our digital capabilities and our patient face throughout the system. So that was already underway. Now, when the pandemic first took root, it created a situation where caregivers were, on a forced march for really 8 weeks of working nearly around the clock. So what was occurring during that time, was a lot of organizational innovation. It's quite interesting. The ability to take a selection process for, let's say a company like Heal that might have been known to folks, but was in the queue, was you had to be further validated, doing a pilot, all that had to be compressed into a period of 2 or 3 weeks. So, there was a pivot for the organization. Our virtual care visits in some categories went up from a couple thousand to a couple 100,000. So just as dramatic a spike as you could imagine. So I would say 2 things happened. Obviously, the entire organization pivoted. The care model changed in many ways, but again, the ways it was the new aspects that we're adopting were had been present in the field before, and now, as Greg noted, they are being accepted both by patients, caregivers. I shouldn't say both, by patients, caregivers, and payers. So, the system overall has adapted. Our studies show that the level will probably go back to something like 30 or 40% of primary care might be delivered electronically or enhanced electronically. Obviously, that's still being sorted out. So, I think the key thing for us and any provider is, this is a chance for an organizational reset. What will primary care look like in the future? We, in parallel to the pandemic, we were in the process of organizational change. We renamed ourselves from Partners Healthcare to Mass General Brigham. We've done restructuring where we have basically a core focus on value-based care, and then also the integration of our system to provide the patient a seamless experience where they would not themselves recognize the organizational boundaries that had characterized the system prior to this integration. So just a sampling, it's as big a topic and an ongoing level of discussion, and obviously one that is ramping again around the country, even in New England. But I would say lots of interesting innovation. Talk about PPE, things that an area that I think wasn't as anticipated, but now is so widely recognized, which is the need to redesign supply chains. So we and virtually every provider of whether it's a hospital or another setting has had to approach this in a different way, look at more domestic supply, what the cycles are, how much we have to keep on hand. We went from, in some categories where we might have, a couple thousand of whatever that unit is, to 80 pallets full, where we have to have it, we have to be ready to go. And so relearning that, the adoption of digital technologies for that is a real key. And then, for us, the use of new tools, we were one of the first and largest adopters of the Battelle decontamination system, where we, for our entire system, that ultimately, I think something like 400 providers throughout New England accessed this, gaseous technologies, VHP technology, to decontaminate and reuse N95s. So just some of the things that are occurring, and it's still happening now. Thank you.
It's very helpful, Chris. And a lot of the areas of investment where we're focused have a hospital component to it. And there's been a significant amount of disruption across the country in the hospital systems, and they have adapted very quickly to be able to continue to provide care. And to the point that Greg made about HEAL, it's getting to these patients, right, to make sure, given the number of decreases in diagnostic procedures that are impacting them. Michael, we have a huge amount of respect for your organization, Lincoln, where you're a managing director. You have over 30 years advising companies in the healthcare markets and have an incredible perspective. Why don't we move a bit? We've covered a lot of the second topic in the first section around accelerating the delivery of virtual care and home care. And there was a research report that Lincoln put out in a post-COVID climate, home is where the care is. And you highlight that home health and community-based care is positioned well for growth. Can you talk and dive in a bit more on what areas you expect to see the most growth and what the factors are driving this shift?
Thank you, Adele. So home healthcare has been over the years seen significant growth. If anything, that has become even further accelerated given the pandemic. The home healthcare still has a lot to learn, has still a lot to invest in. It will have to improve in the way the patient is maintained and cared for and monitored at home. But fundamentally, the tailwinds, the need for that care, the patient preference, the payer dynamics, and lots of other factors that are really driving home health services and products. Some of the areas that I think will see kind of the most emphasis and growth going forward, number one, non-medical home care. This has risen in terms of activities and interest, given the concerns around social determinants of health. And really the notion that medical care is important for these patients at home, but we also need to make sure that the basic non-medical and social functions are being addressed. Ideally, you have sort of a combination of medical and social care at home to be effective, and then, quite frankly, combine that with telehealth as a monitoring capability. So I would call out non-medical home care. I would call out patient-directed home care. A number of states now are passing rules and regulations for the patient to kind of direct who's involved in that care, number of transactions, and I think implement more of those types of programs, we'll see patient care grow. Greg, to your point, physician house call has an important function. These high cost, chronically ill patients that are non-ambulatory are often frequent flyers to the ER and to the hospital, quote unquote. And it is important that in addition to nursing and non-medical care, that we also provide that physician care element as well. So I think that's a growth area. Home medical supplies. I know we keep talking about nursing and caretaking, but the recurring supplies needs of these patients is significant. A lot of them are chronically ill. They need to be on these recurring supplies. They need to be monitored. So I guess ideally you combine home medical supplies with telehealth as well to keep connected to that patient and make sure that they do their basic supplies, that they address those basic supplies needs. Telehealth, of course, is going to be growing, more investments to be done there. And then, quite frankly, home healthcare IT. Home health, as well as healthcare overall, is still behind in terms of IT and data analytics. Home health, arguably even more so. How do we tell a payer, how do we tell a hospital that we are doing everything post-hospital discharge or post-nursing home discharge to ideally monitor, maintain, and care for that patient? We need to be able to have data and analytics to show that, so that we can be more effective post-acute in our post-acute care, and also be more in tune with value-based, and outcomes-oriented programs. And finally, the consumer. The medical consumer is going to play a more active role. I mentioned patient-directed home care, but in terms of home care products and other basic types of home care services, the consumer will become more involved. Longer term, there's some other interesting markets to keep an eye on. For example, home modifications. I think as we all get older, I think we're going to want to spend some time to modify our home and to have a sort of more assistive, easier environment for our care needs. But those are some of the areas, Adele, that I think are going to be showing growth in particular. But quite frankly, most areas of home healthcare are going to be showing probably very good growth over the years to come.
Well, we should definitely talk after this, Michael, about some of the companies we're aware of, and would love to talk to you more about some of the ones you're working on. It makes me want to turn it over to Chris and get into a bit of the investment and M&A side of things. So, Chris, as part of your role managing the $200 million venture fund, what themes are you looking at and pursuing as a result of the pandemic?
Yeah, first of all, to give credit where it's due, we have a team of 4 partners that actually directly run the fund. I'm kind of above that, but to their credit, we think it's the top performing academic venture fund in the country. We're actually out raising our next fund, which will be a $250 million fund, with a big portion of that coming from inside the system and the rest from external investors. But to answer your question, I'm sure most of the people on this call have been tracking the unabated market for life science investing over the entire course of the pandemic. One of our portfolio companies was the first out for an IPO after the crisis was declared, and if anything, the overall level of investment, both in terms of new therapies as well as digital, is up. What was it? Last quarter was 44 new digital companies with $580 million in investment, at least according to CB Insights. So from our standpoint, the work of our faculty relative to discovery research and its application, which is really the focus of our fund, that has remained strong throughout. There really was almost no break in the research progression. A little bit, but not a lot. People worked from home as they could. And then on the digital side, again, picking up on our earlier discussions, adapting digital tools to fit into the workflow, adapting the workflows to better utilize new technology. And then several folks have noted, the broad recognition of the disparities caused by COVID, and then the response to that. So for us, that's an individual, it's programmatic. It's also got a technology dimension as well. And, those are our ongoing priorities, and we'll actually be doing even more on that over the next several months.
Mm-hmm. And Sunny, Bristol has grown through multiple acquisitions. So do you have a perspective on acquisitions during this time, integration of the acquisitions, and provide a perspective as the buyer?
Yeah, we've certainly been busy this year. We have had 8 acquisitions year to date, and surprisingly, 6 of those have happened since March. And so we've had a lot of activity, even despite the pandemic and all that's gone on. And I think, as I mentioned earlier, the integration piece is so key on communication. And I think you really have to understand, as you're the buyer, and that may be for any investors out there as well, is to evaluate the measures a company has taken as they put their response into place for COVID. And what measures are they taking? How has it impacted their business? What strategies are they doing to maintain that, at least up until the time when that transaction could occur? If a company is not thinking upstream and having the foresight around navigating all of the challenges that are out there that don't appear to be going away anytime tomorrow, it could be detrimental to a company and to a transaction as well. And I think from a business development perspective, companies should be constantly refining their strategies and their plans. What worked last month may not work again this month. And so you really have to make sure your business is diversified, that all your eggs aren't in one basket. And I think if you watch and listen closely to the market, it'll tell you how it's unfolding. And I think that's just really, it's imperative that you pay attention to what's happening in each individual market where you may have a potential transaction in.
I completely agree. It's great insight. And Greg, last year, Heal acquired Doctors on Call. This year, you announced the partnership with Humana, which we mentioned. And as EVP of Corporate Development, we'd love to hear how you're thinking about growth as we emerge from the pandemic.
Well, growth is done in partnership with the payers, right? So Heal this month actually is our 6-year anniversary. So we're still a very early stage company, and there's a lot that we're continuing to learn and we'll figure out. But fundamentally, as we're operating in the commercial pool of lives, seeing adults and children, that is sort of one set of dynamics and needs. And then when you get into more of the Medicare Advantage populations with chronic conditions and whatnot, that's a very different set of needs, right? And so what we started out doing in our early days was sort of working from a wider net, if you will, right? Trying to help a number of different constituencies. And what I think we've learned over the last number of years, and in particular, to Chris's point, the amount of data we would have liked to have synthesized in the last 6 months, would normally take a longer period of time, but you're doing it in real time now, right? On a day-to-day basis. We've been able to see where our tools and our provider model can really be a solution, very succinctly, very targeted for our payer partners, which was one of the reasons that led to the Humana transaction. As well as actually our acquisition of Doctors on Call, which was very focused on a 65 and over aging population with lots of chronic conditions. That population of people by nature are less mobile, right? The care is more complex. There's more medications involved. It can be fragmented care if there's other specialists involved. And so the fact that we're able to be in the home and actually be on the ground, seeing those social determinants of health, helping close gaps in care, these are measures that can go a very long way, right? And so as we will continue to keep an eye out for additional acquisition opportunities like we did in New York, we're interested in both populations of people where we can really apply our tools in a very meaningful way, but also in a way that those outcomes are really driving the needs of the payer, right? And so we're thinking about those different models as we look into our expansion plans. Currently, we're operating in 8 states across the country. That is sort of a mix of California, New York, New Jersey, Georgia, and a few others. In the new year, we'll be opening Illinois, North Carolina, Louisiana, and 1 to 2 other markets as well. And each of those, as we go into those markets, is based on partnerships with payers, possible acquisition opportunities like we did in New York, and really making sure that we are, hitting a very driven value proposition for those that we're working with.
That's great. Yeah, really critical now and going forward, particularly with those patient populations. And Michael, as you look at and you think about M&A in this environment, are there certain areas that you feel are likely to get a lot more attention over the next 12 to 18 months?
Yeah, certainly. And Adele, there's been good growth and of course acquisition consolidation activity in the broader home healthcare arena, even pre-pandemic. If anything, it has been further accelerated, as we go through the pandemic. I'm not going to talk about all the drivers that's driving that, but keep in mind now you have private equity groups who don't have an investment yet in home health. They are looking very actively. Given all the trends, you have already PE-backed larger portfolio companies like Sani's, Bristol Hospice, and then you have larger strategics, payers, hospital systems, other home health providers that are well capitalized and looking to do acquisitions. So you have a great demand and supply dynamic. Here are some of the markets, and what we're seeing right now is I think we're going to see a tremendous amount of M&A activity further accelerated over the next 12 months versus what we've seen even in years past. Here are some of the markets that are seeing really strong consolidation M&A activity. Hospice, first of all, not a week goes by where we're seeing or hearing about yet another hospice acquisition, small or large. Skilled home health will continue to have a solid clip of M&A activity, especially as that sector on the Medicare side has come out of the PDGM reimbursement methodology change. Non-medical home care, I talked earlier about that important space. We are just seeing there now double-digit EBITDA multiples being paid for larger platforms that we've also seen in skilled home health and hospice. But here are some of the other segments, some of them are niche in aspect, where maybe investors haven't so much focused, but where we do see additional M&A activity. Consumer medical products, providers, distributors, suppliers. I think that's an important arena because the consumer is getting more involved in terms of making sure that they have the right medical products and care products in place. Telehealth, of course, technology or service providers that cater to the telehealth market. Greg, I don't say it just because you are here on the line, but Physician House Call has seen increased investment in M&A activity of late, and I think that'll continue. And then specialty home care products and home medical supplies, again, for some of the reasons I mentioned earlier. So tremendous amount of M&A activity throughout, but unfortunately, it also means paying a higher EBITDA multiple nowadays for some of those quality platforms.
That was a great summary, Michael. Thank you. Excellent summary of what's happening in the market. Just one question, I'll throw it up to the group. How do we deal with the delayed diagnostics facing us in healthcare right now? There's been such a decline in a lot of testing of patients and the concern next year and years to come, the impact. Maybe I'll turn it to Chris for that question.
Was that a general question about the diagnostics field or
Yeah, and moving to the home and trying to get more diagnostics to the home, just staying with the theme.
I think our view would be, at least my view, there's kind of a fracturing of the diagnostic solutions, and some get through, many just stay at a relatively small level. And even interestingly, if you look at diagnostics associated with the pandemic, our clinicians are negotiating with companies that have 100 employees, and we're looking to deploy tens of thousands of tests. The need for scale, I think, is still, it's out there and maybe it's coming. But yeah, the lack of resources on in the investments in diagnostics overall, I think, explains some of that. But I think the general responses that will be implemented, nationwide in the next year will drive more towards scale than we've seen recently.
Thank you. I could actually go on and talk to the four of you about a lot of topics. I'm getting the note coming in to please wrap up, unfortunately, because I would love others' perspectives on this question. So thank you, all four of you, for a very engaging panel, the topics, and covering the challenges presented by COVID, how your businesses have overcome it, the acceleration of different business models within virtual and home care, as well as the perspective on investment and the overall environment. This has been the fastest 45 minutes of my life. But now I will turn it over to John Surrett to wrap things up.
Thank you, Adele.
Thanks, everybody.
Thank you.
Thank you.
And thank you, everyone. As Del mentioned, my name is John Surrett. I am the president of ACG Boston, and I'm also a partner at KLR, which is a large regional public accounting firm based in New England. I run our private equity venture capital services group. I'd like to thank our speakers, as well as White & Williams, as our sponsor of this session. ACG Boston is proud to partner with ACG Philadelphia in M&A East this year. In a moment, you're going to be returning to the ballroom for some brief networking. There'll be about 15 minutes before the start of our final program of M&A East, which is the rise of the operating partner, growing relevance in a pandemic world. I'd ask that you please stop by White & Williams' table on floor 2, table number 51, to introduce yourself before the next program begins. And don't forget to stop by the ACG Boston table, which is on the first floor, and come say hello to us. Look forward to seeing you all later on. Thank you very much.